few more people to wait for. We're not going to wait too long because I want to get the quiz going. Okay, I think Chandra here? I haven't seen Chandra. Clarinda. So we're just waiting on two more students.
Miss Marva,
Yes.
when we finish the quiz, I'm on my phone with the Zoom. I'm gonna can I log out and get on my computer on the Zoom? When we finish with the quiz, I finish with the quiz to log into my computer instead of.
Yeah, is there any
Don't we
reason
have
you
to have
can't
our
take the
phone on
quiz on your
Zoom and our
computer?
computer?
Oh. Any reason you
No,
can't
that's what
take
I'm
your...
saying. I'm taking the quiz.
However you can access
That's
the quiz.
No, I'm saying I have my phone is on Zoom and my computer is for the
Oh,
quiz.
yes,
Yes, that's
yes,
how I
yes.
had it.
Yes,
But I'm
yes,
saying
yes.
when I finish, can I put Zoom back on my computer?
Yes, of course. Yes,
Okay.
of course. Thank you
Okay.
for clarifying that.
Okay.
Okay, we've got everybody here. So let's just start out with taking the quiz. It is 3 o'clock, so it should be unlocked as of now. And then I'll go when we're done with the quiz. Okay, so listen, with the quiz, it's a key grade assessment. You got to stay on camera. Okay, you got to stay on camera. When you're done the quiz, I don't need to know that you're done the quiz, but hit submit. Okay, don't go. If you have to get up and go do something, that's fine. But you have to be back at 20 after the hour. But don't log off because then it's just going to dock you attendance. Okay, so you got to stay logged on. If you need to go do something, if you finish up the quiz early, but be ready to go at 15, 20 after. Okay. So the quiz should be available for everybody now. So I'm going to mute myself. I'll make sure everybody else is muted. Destiny, I'm going to mute you.
Miss Marvin for a code.
I'm sorry, what?
It's asking. It's asking for a code. Mine's asking
Oh,
for a
yes,
code.
yes. That's the other thing I have to do. I had to put an access code. Yeah, okay, so you guys ready? I'll put it in the chat. You guys are on top of things today. Oh, wait a minute here. The access code is my last name. So I'm going to put it in the chat. Don't do anything with the Zoom in the chat. Or the Kahoot in the chat. That's for later. All right, so go ahead and start the quiz. Make sure you hit submit when you're done.
Ms. Marva, you said just your last name?
It's in the chat. Okay,
Oh, okay, I'm sorry.
that's okay. Yes, it's my last name. Mhm.
Hey, Miss Marvel.
Don't forget to hit submit when you're done. I still have a lot of outstanding ones that aren't submitted yet. Has the time run out yet?
No, Miss, I was gonna ask,
Okay.
can I, I'm done. I thought I hit submit already.
Okay,
Swap to my, put my computer on Zoom and on off
Okay.
now.
that's
Okay.
fine.
You see it submitted or no?
I'd have to check. I think people are still
Okay.
working on it, so hang on.
Because it gave me my score to 8 out of 10.
Okay, all right.
Okay, okay, all right.
Let's let everybody
Oh.
finish. That's okay. Okay, looks like I have everybody finished. So if everybody could come back on camera, that would be great. And thanks for everybody for being on time today. I really appreciate it. It helps to get started. Okay, just waiting for a few more students to come back on camera and then we'll get started. Before we review the quiz, just a couple of things. Welcome to week 2. Okay, you made it through week 1. I'm sure last week was incredibly busy for everybody with all your classes. Oops, bless you. That was a sneeze. Bless you. Mariah, if you can go back on camera. Lizzie, come back on camera.
Professor Marvel, I want to get off my phone and get on my computer. Is that okay?
Okay, yeah, of course, of course. So as I was saying, last week was an incredibly busy week for you guys, getting organized with classes and syllabuses and due dates. And I hope you took some time over the weekend to get everything organized and ready to roll for week 2. We're going to be covering weeks 1 and 2 concepts today. You have, whoops. Okay, you have your PowerPoints. We'll go through and I'll pull those up as well. But let's review the quiz and we can do some lecturing and teaching off of the quiz. As far as announcements that I posted this week, let's take a look. Hang on 1 second. Okay. Share my screen. I put a Kahoot in the chat. Well, hopefully we'll get to that. If not, it's okay to do the Kahoots on your own. It was a week 1 and 2 Kahoot. I don't know if anybody's already done it since I posted in your announcements, but you can do it prior to class or we can do it during class if we have time. If we don't, then do it after class, but it's a good review. Let's see. Doesn't look like I posted anything. I posted your week 2 announcement. Hopefully you took a look at that and that's where your PowerPoint is and your note taking. Now you have 2 attachments for each week. One is the PowerPoint that covers the concepts or an outline. Remember, a PowerPoint is an outline of concepts. And then I'll be teaching from that. And then you have a notes attachment in which you can take notes. I highly encourage you to take really good notes during lecture. This is where all the information is built upon that PowerPoint. Okay, let's take a look at quiz 1 first off the bat. Can everybody see my screen? Okay. So in your preparation, what did you learn about what is community-based nursing?
Community-based nursing is when we're taking care of a person one-on-one,
Okay.
like hospice or
Mhm. Right. You're community-based. Remember that. That's how I remember that. If you're community-based, you are based in the community, caring for a client or a family in the community. Okay?
You would, in the community, meaning that you were saying basically we will try to give them interventions before anything happens.
No, that's not quite, that's the primary, secondary, tertiary. We're looking for the difference between here, community-oriented nursing and community-based nursing. All right, community-oriented is the big picture. That's the public health nurse looking at community-oriented. You're looking at the whole community. If you're community-based, you're based in the community caring for a client. So which is the right answer here?
B.
B, as in boy. Right? Why is
Yes.
that the right answer?
Because it's a child, it says a child. and
What's the
teacher
setting?
is taking care
A
of
school.
that child.
In a setting, right? So
Yeah.
in this case, this is the school nurse, right? She's teaching a child how to use an inhaler. That's an example of being based in the community, taking care of a client. All the others are really big picture and looking in the community oriented. All right. You're looking at developing a teen pregnancy program. That's for the whole community. Okay. Evaluating the outcomes of a community vaccination program. That's for the whole community. Providing diabetes education, whole community. Right. But if you're specifically educating a child
Yep.
and a school teacher on the use of an inhaler, that is community based. Okay. Question 2, this required for you to go into that website, Healthy People 2030, that was in this center section of your syllabus. It was also in your week 1 announcement to learn about what Healthy People 2030 is. Healthy People 2030 started, just so you know, Healthy People started as Healthy People 2000. Okay. And then 10 years later, we had Healthy People 2010. Then when I started teaching at Fortis, we were into Healthy People 2020. Now we're bumped up to Healthy People 2030. Okay. What is the overarching goal of the Healthy People 2030 campaign?
A. Lecture A.
A, it's a framework. It's an outline of trying to improve the healthcare of all Americans. It's a national campaign. Okay? So if it's a national campaign, the other 3 answers don't make any sense. Establishing guidelines for treating most common chronic illnesses. It's way beyond that. Okay? It has nothing to do with a standardized nursing curriculum. Okay? And it doesn't address focusing from community to individual. Does somebody need to mute? Could somebody mute with all that background noise? That would be great. And it doesn't look at changing the focus from community health to individual health. Okay, it is an overarching general framework that looks at improving the health of all Americans. And if you did have a chance to look at that website, it's very, very impressive. I would really, pardon me?
It was.
It's really, really impressive. It covers really every topic. Okay, question number 3. Okay, so this was still in week 1, and this was under the introduction to vulnerability section. Okay, so just think about this question in a common sense, from a common sense standpoint. Which is true regarding uninsured or underinsured individuals? Just think about that as a general question. Before we even look at the answers, what kinds of things are the uninsured, underinsured going to be more at risk?
That they won't go to the doctor regularly because they can't afford it.
Right? Absolutely. Their access is going to be limited. Right? So when that happens, the answer C is a likely outcome. They are more likely to be diagnosed with advanced disease. Does that make sense? Underinsured, uninsured. They're less likely to have decent access. Therefore, they're probably not going to be focusing on their primary health, right? Going for checkups, doing their screenings. So therefore, by the time we see them, in whatever kind of facility we see them, they're much more likely to be diagnosed with advanced diseases. Right? So A is incorrect. It's just the opposite. They're less likely to attend preventative wellness visits. B is the opposite. They are more likely to develop preventable. They are They're more likely to develop preventable diseases, again, because they don't seek out their primary care. And D is the opposite. They're more likely to need government health resources. We'll talk about more of that when we get into the content of the lecture. Okay, again, this question comes from the introduction to vulnerability sections. In your Canvas reading under introduction to vulnerability, it gives you a whole list of clients that are considered vulnerable populations. The correct answers here are B, veterans are considered a vulnerable population, irregardless of their age. Substance abusers are considered a vulnerable population, irregardless of their age. And same with clients with HIV, they're considered a vulnerable population. D is not considered, yes, it's a infectious disease issue, but it's not considered, this is not considered an overall vulnerable population. Why is A incorrect?
Because of the age.
Because it's not a
Because of the
teen.
age.
Exactly. Great. Good. A lot of people, pregnancy in general is not considered a vulnerable population. Teen pregnancy is. Okay. What does the term resiliency mean? What is it? Just overall.
To
What does
keep
it mean?
going, to push forward.
Push forward.
To keep going, to push forward.
Push through. Right? So one of the most important things that we need to work with our vulnerable populations is to increase their resiliency, because they're already at risk. Right? They already have the cards stacked against them. So one of the things that we want to work with these populations with is increasing their resiliency. Right? So which answer is correct? Which statement reflects the term resiliency as it relates to vulnerability?
A.
Later A.
The more resiliency you have, the more likely you're going to be able to reduce your vulnerability. Okay, B is the opposite. Resiliency decreases the likelihood that you're going to get sick. Right? Because you have that fight, you have that motivation. Resiliency partly can depend on genetic predisposition, meaning passing it on from one generation to the other, but solely it's not the only reason.
Mhm.
And then D, resiliency definitely can be learned. That's, I mean, none of us are born with resiliency. We learn it. However we learn it, through experience, through knowledge, through practice. So resiliency is a really important part of nursing in general. All right, we're always wanting to push our patients to get better, to adapt to the teaching, right? We're always pushing them to improve the quality of their life,
Mhm.
right? I mean, just as in nursing, that's what we do with our clients. We're their advocates. So we're always trying to push them. Even more so when we're working with the vulnerable populations. Those are the clients that are more likely to not have resiliency, right?
Mhm.
Okay, so this is a safety question. This comes from week 2 and the school nurse information. So this is a prioritization question, right? So who are we going to care for first?
The kid
The
that's
B.
coughing.
The one that is coughing.
Yeah.
Airway, breathing, circulation.
Remember, a lot of this school nursing content is going to come from pediatrics as well. Okay, so the kid who's coughing, unable to participate in physical exercise, what are those some symptoms, signs and symptoms of?
Airway,
Asthma.
breathing, and circulation, where
Yep. And more specifically, what are those signs and symptoms of?
respiratory.
Respiratory.
Asthma exacerbation,
Mhm.
right? So like Charmaine said, that's your ABCs. Okay, it's not to say that the kid complaining of itching with a rash or excessive complaining of burning, excessive tears, inability to focus. Those are, the school nurse will end up seeing all these clients, right? But the question asked, who should you care for first? And that's my first teaching. This is my first teaching moment for exams. Okay, what is the most important word in this question?
First.
First.
First. That means it's a priority question. If it didn't say first, you could, any of these would be correct, right? But it says first. You have to be able to recognize the important words or phrases or cues in a question. So when it says, what are some other keywords that you might see? Initial, first, last,
Priority.
what?
Priority.
Priority, what's the most important, what's the least important? There's always going to be cues in a question. Takes me to my second exam teaching strategy. I don't know if you all use the highlighter or the line crosser outer in the ExamSoft, but I would highly suggest you do. Okay, you can go in. I always tell students, again, I do a lot of teaching off these quizzes, so you're just going to have to bear with me. Okay, so when you go in and you read a question first time through, right, you want to take that highlighter and you want to highlight anything that jumps out at you, any kind of word, priority cue, priority phrase. You want to highlight that. Okay. Then you want to try and come up with your own answer in your head. Right? Before you even look at the answers, see if you can come up with an answer in your head. And then go into the answers and start looking at them. Does anything match what you came up with in your head? If it does, it's probably the right answer. So the second part of that is highlighting anything important in the question. But the second part of that is using that underliner and crossing out, this is your first time around with the question, cross out anything that you can toss out. That doesn't even make sense. It's not even in the ballpark. Cross it out. So then when you go back and read the question the second time, which I know you all do, right? Nobody just reads the question once, right? Great. Great. I'm glad to see that, even though I
I
can
did
only see
today.
three. I can only see three of you because I'm sharing my screen, but I know you're all shaking your head. Nobody just reads a question once. So when you go back and read it the second time, you have something that's highlighted, hopefully, and maybe you're down to two answers to choose from. So I stop and talk about that because this is the first question we have that's a priority question. Okay. I don't know if that helps, but based on my teaching experience and meeting with students all the time, that works. All right. Okay, question 7. This comes from your iron deficiency
Eggs.
anemia reading. Eggs. Why? Clarinda, why eggs?
High in protein.
Protein,
Yeah. Yeah. That is correct. Okay. School nurse notes a dark discoloration along the neck crease in the armpits of a child. Which steps should the nurse take? First of all, before we answer that, what are these some signs and symptoms of?
Diabetic.
Yeah, think med surge, possibly diabetes. So what do you want to do?
B.
B.
Evaluate.
Yeah, you need to have them have a medical evaluation. Okay, you're not going to be checking the scalp for excoriation marks. You're certainly not going to be reminding them to put cream on. And diet really at this point has nothing to do with it. We're just looking at the symptoms given in the question, potential sign of childhood diabetes, right? So you want them to get a medical evaluation. Okay, number 9. Which nursing intervention is a priority for a child experiencing developmental delays? Before we even look at the answers, what word would you highlight in this question if this is an exam question?
priority.
Priority.
Priority. All right, so think of what concepts we're covering this particular week. So what would the answer be?
A.
Letter A.
A. We're covering lead exposure in this concept. So one of the potential outcomes of lead exposure is a potential developmental delay. It's not to say that C and D couldn't be correct answers as well, but the question is asking about priority. So what's the first thing we want to think about? Potential lead exposure. Maybe we do want to do a family history of developmental delays. Maybe we do want to advise increasing iron, but that's not what we're doing as a priority. Does that make sense? And then the last question, nurse notes a child's BMI is in the 90th percentile. Which intervention is appropriate? Well, what does a BMI in the 90th percentile mean?
They fat.
Obese.
They're overweight, right? So you certainly wouldn't do A. You don't really need to refer for an urgent medical evaluation at this point, but C is the correct answer. Encourage parents to reduce overall screen time. What's the significance of that?
Getting out and playing.
Getting up and getting some exercise and moving. And D is totally wrong. We wouldn't recommend 100% fruit juice between meals. It's all sugar. Right?
I have a question.
Okay, go.
My computer keep on going in and out when you was talking. What was the answer for number 8
Mm,
about the DART discoloration?
that was medical evaluation.
Advise the parents to get a medical evaluation.
Mhm.
Okay.
Yep. I don't know why I'm on the big screen here. Let's see. Okay. Okay, questions about the quiz? What do you, I mean, the scores, trying to get all of us on there. There we are. The scores are all over the place. I mean, what's your evaluation? Does it make more sense now?
Miss
Yeah.
Martha, you're sounding like the robot. You're breaking up.
You're going in and out.
I thought that
I'm
was
thinking that's my
computer.
phone.
No, she's
No.
going in and out. I
Oh my
thought it was
God.
mine too.
Sorry. My internet's been fine. I don't know what's going on here. Give me your feedback on the quiz.
I felt like some of the
Okay.
stuff that we covered in the Kahoot and the readings and stuff like that. Some of the questions weren't on there. I mean, like, in my opinion, that's just my opinion. But yeah, hey, we live and we learn. Yeah.
Let's go through the content from weeks 1 and 2. So here's why I need you to take good notes. Okay, everybody has your, I'm going to pull up the, pull up our week 1 PowerPoint. Okay, so here's the concepts from week 1. Introduction to community nursing, levels of healthcare prevention, Healthy People 2030, and introduction to vulnerability. Okay, so we start talking a little bit about community-oriented, community-based. Okay, so community-oriented, all right? We're focused on health promotion of the whole community. All right, so we're focused on the whole group versus the individuals.
Oriented is the group.
That's what community-based is. All right, so the community-based nurse is the one working in the community with the ill clients. So that could be the school nurse, the occupational nurse, hospice nurse. Those are the community-based nurses. All right, so the difference between community-oriented, community-based is community-oriented, you're taking care of, you're looking at the whole population. Community-based, you're looking at individuals. One of the things that we're going to talk a lot about in this class is levels of intervention. Okay, levels of prevention right here. Primary, secondary, tertiary. Primary, think prevention. Here's the way I remember it. P is prevention. S, secondary, is screening. T, tertiary, is treatment. So in primary, we are trying to prevent something before it ever occurs. Prevention of illness. We're trying to prevent an illness. We're trying to prevent an injury. So as a school nurse, in school nursing, we would talk to kids about helmet safety with bikes, seatbelt safety for the kids who are driving. Okay? Immunizations to the parents that did not want to have their kids immunized. We couldn't force them to get immunized, but we certainly could try and educate them on vaccinations being the most preventable, being the best to prevent these childhood diseases. So that's primary. Preventing something before it happens. Secondary is screening. Okay. I also refer to secondary as early identification and early intervention. That's why we do mammograms. That's why we do colonoscopies. That's why we do, we at health fairs in the community, we'll do screenings for blood pressure, screenings for blood glucose, screenings for BMIs. In the schools, we do vision and hearing screenings. So it's screening. You're trying to identify a risk early on so that you can treat it before it gets to the tertiary. Right? So it's screening for risk. Tertiary, the most important thing for tertiary is you have to have something. You've had an injury, you've had a stroke, you've been in a car accident, you fell off your bike, you have a disease, you have a new diagnosis, you have a new condition. Right? So tertiary is all about treatment, management of something. So management of a TBI. You're helping clients, is let's say they've been diagnosed with a chronic disease, you're helping them reduce the symptoms or help them with their quality of life. You're treating, you're managing. Does that make sense? In the schools with obese kids, we would work with kids to give them strategies to try and reduce their weight, whether it was nutrition, exercise. Okay? So we're going to be referring back to that primary, secondary, and tertiary the whole term. And one of the things you have to be, prevention is standard across the board. Screening is screening across the board. Treatment across the board. But we have to be able to apply it to different, think about the homelessness. Our primary interventions would be a bit different than, say, with the rural population. We have to be able to think about different primary, secondary, tertiary interventions with each group. Okay, we start talking about Healthy People 2030, improve the health and well-being over the next decade. That's why it's 2030. Okay, here's 5 different goals. You don't have to write this down, just listen. 5 different overarching goals. And I read these to you because this is how it defines a national campaign. Attain healthy, thriving lives, well-being, and well-being free of preventable diseases, disability, injury, and premature death. Eliminate health disparities, achieve health equity, attain health literacy, improve the health and well-being of all. Create social, physical, economic environments that promote attaining the full potential for health and well-being. Promoting healthy development, healthy behaviors, and well-being across all life stages. Okay? One of the things we talk about in community health is social determinants of health, SDOH. These are all the conditions that make up who we are. Where were we born? Where do we live? Where do we work? Where do we worship? Okay, all these kinds of things affect the social determinants of health. Okay, what is our economic stability of the individual, of the family? What's our education access? These all make up the social determinants. What's our healthcare access? What does our neighborhood look like? Is it a safe, clean neighborhood, or is it a dirty, crime-ridden gang community? And what does the social resources look like in the community? Is there a lot of sports? Is there a lot of religious areas to gather? Are there a lot of parks? All those things make up what determines how all those things make up the health of the community. Okay? Vulnerable populations we talked about. Vulnerable populations are in all of our communities, are they not? Okay, we all have kids in our communities. We all have elderly in our communities. We have people who are chronically ill. Another vulnerable population is the non-English speaking population. They're vulnerable with the language barriers, correct? I guess I should be skipping along. Oh, sorry, I knew I had these somewhere. Here's the 5 overarching goals of Healthy People 2030 that I was just reading. They're in your PowerPoint. Okay, vulnerable populations, children, elderly, chronically ill, non-English speakers. Okay, what is vulnerability? You guys tell me, what's vulnerability? What's vulnerability? What does it mean when you're vulnerable?
You're not unable to take care of yourself and do things for yourself or provide the care for yourself.
Okay, great.
You're in
What
a
else?
low state.
Pardon me?
You're in a low state, like
Mhm.
state of being.
Mhm.
I have a question. You're breaking up, like really bad.
Okay.
Oh,
Um,
It sounds like you're on, let's see. It sounds like
sounds like you're on
your
a hotspot
computer
or something.
and your phone at the same time. That's the way it's sounding.
okay, are you picking up what I'm saying?
Some, not
Yeah,
all.
yeah, some of it, but not all of it. It sounds
Every
like
few
you're
words.
hotspot or something.
No, I'm not on a hotspot. I'm on my regular internet and I'm sorry. I'm sorry. Hopefully hopefully the recording is picking up all of this. I had an issue last week. I talked to Zoom and they said everything was fine. So I don't know what's going on. My internet is stable. I've been on my internet all day. I'm just gonna have to do the best I can. I'm sorry. Sorry. I'll keep going. So vulnerability. Vulnerability affects a lot of things, right? It affects healthcare. It affects choices we make. It affects healthcare access. Kids are very, very vulnerable. Elderly is very, very vulnerable. Why do we think the elderly is considered vulnerable?
Because some of them feel like they lost their independence and they depend upon other people for things, and that's not safe at all times. But it can be depending on who the person is or who's helping, and the resources. They don't know where to go for the resources.
Exactly. And they're also very vulnerable for abuse and neglect.
They're caregivers, yes.
Exactly. Exactly. Chronically ill. A lot of chronically ill clients in the community. They're very vulnerable as well. Okay, they're vulnerable for getting to appointments. They're vulnerable for making appointments. Maybe they live alone. Okay, they're vulnerable for maybe understanding, teaching them about their chronic illness. What about non-English speakers? Why are they vulnerable?
Not understanding what you're saying to them.
Exactly. Maybe they're not understanding their diagnosis, not understanding how serious their condition is, not understanding how to care for themselves. And yes, it's great to have family members available, but how do you assess how much they understand? We talked about resilience, poverty. What about our individuals or families or groups in a population that live in poverty? How do you think poverty affects vulnerability?
They're
Their
unable
environments.
to afford to live in safe neighborhoods,
They're
buy
limited.
nutritional foods.
Go ahead, Mariah.
I said they're limited to
Very
resources.
limited. Very limited. I mean, what if you have what if you're the community nurse? I had many schools over the course of my 20 years in school nursing where almost the entire community of the school lived in poverty.
Mm.
The kids were sicker. The kids weren't able to follow up with doctor's appointments, less compliant with immunizations, implementation of breakfasts and lunch and after school snacks for all these kids. You know, the more the poverty, the increase in the resources individuals, kids, families are going to need. Poverty is the primary cause of vulnerability in this country. And a lot of vulnerable populations you're going to be working with will live in poverty. And that could be the individual, the family, a small subset of the population. But poverty is the leading cause of vulnerability. Poverty leads to chronic diseases. It leads to acute illnesses. You know, what if part of the community is living in crowded conditions? The spread of infectious and communicable diseases. What if people living in poverty have a high unemployment rate? That's going to affect them as well. Less options for nutrition or good nutrition. A lot of times in the schools and some of the buildings I was in, the only healthy meals these kids got were in the schools. When they came to school to have breakfast and had lunch, and then we sent them home with snacks to get them through the rest of the day until the next morning. Veterans, we talked about veterans, why they're vulnerable, right? Deployment can have a really negative impact on the individual and the family. And believe it or not, with veterans, there's a higher risk of domestic violence and child abuse. Kids of deployed service members are more at risk, right? They have more issues in schools, anxiety, depression, peer problems, behavioral issues, even suicidal ideations. Vulnerable populations have increased morbidity and mortality, increase in illness and increase in death. So what are some nursing interventions that you can think about for vulnerable populations? Resources is the big one. All right, resources in communities, in schools, in churches, in grocery stores, wherever we can provide those resources. It's really hard to break the cycle of vulnerability. A lot of times it's generation to generation. The one thing that's really important with vulnerability is working with vulnerable populations, showing respect, compassion, and concern. A lot of people don't choose to be in the situations they're in, right?
Mm-hmm.
And we're talking about the community setting. A lot of people, specifically for this class. All right, we can't make assumptions about people or families. We have to let them tell their stories, asking them open-ended questions.
Mm-hmm.
They will tell their story on how they got there and what their hopes are for the future. But as a community nurse, public health nursing, if you're working in the community, you are going to be working with vulnerable populations. We would like to focus on prevention, right? But a lot of times we're already into the secondary and tertiary levels with the vulnerable populations, even though we'd like to focus on prevention. right? Because they're already at risk. Vulnerable populations are already at risk. We're kind of past the primary. We're now into secondary. We've identified them as at risk. So what can we do to help them? What does the homeless population need for screening? What does the teen pregnant mom need for screening? All right, so although we'd like to focus on primary care, when working with vulnerable populations in the community, we're often focused on secondary and tertiary. We've identified them at risk, or they already have something. They've had an illness, an injury. You know, in the schools, it could be a diagnosis, an allergy, an asthma, it could be a TBI, it could be cancer, could be epilepsy. And the other thing about community nurses is we have to be experts on resources. I remember as a school nurse, I used to have a whole booklet of all these different resources we had in the community, because each time I talked to a parent, they needed a different resource. All right, so if you're in the community, you have to be well versed on what your community offers for resources for all different clients, because every time you go into a home or do a home visit or see a client in an urgent care, everybody's going to need a different resource. Okay, so that's just our introduction to vulnerability. I think we start in week 3. We get into talking about more specific vulnerable populations, the homeless, the teen pregnancy, HIV, infectious diseases. Okay, so that's our introduction to vulnerability. Let's jump into week 2. This week, school nurse, growth and I guess I'm not doing a very good job sharing my screen. We talked about resiliency, disenfranchisement, poverty. Here's our groups: poor, homeless, pregnant teens, veterans, migrant workers, immigrants, mentally ill, substance abusers. Here's our social determinants of health that we talked about. Just reviewing here. All right, all of these 5 make up how our situation looks, how an individual's situation looks, how a family's situation looks, how a community situation looks. What's the economic stability of the community? What's the educational access, healthcare access? What does a neighborhood look like? What resources are in the community? And your reference page on all of these will be your 3 books. Okay, so week 2, we talk about school nursing, growth and development, common childhood ailments. And if you've looked ahead to your discussion question 2 for this week that's due Wednesday, it's about the common childhood ailments. You're going to be picking 3 and developing an educational plan. Okay, so let's see. School nurse. School nurse has a lot of different roles. Okay, school nurses can be direct caregivers. They can be educators, consultants, case managers, and they do community outreach. And in my role, I participated in all of those. Okay, school nurses play a really important role in the healthcare team with kids at school. Okay, so as a school nurse, primary prevention. Remember, we're trying to prevent something before it happens. Prevention of injuries. High schoolers, even middle schoolers, we work with trying to prevent substance abuse behavior. We try and work to reduce risk of disease with these kids. Okay, secondary prevention, we're trying to identify kids at risk. Okay, kids at risk for obesity, kids at risk for gang-related behavior, kids at risk for violence, kids at risk for behavioral problems, kids at risk for experimenting with sex at a young age. We're trying to identify the kids at risk. Sometimes that comes from the kid's behavior. maybe the kid's language, the family situation. Where we're always trying to identify, the school nurse is always trying to identify kids at risk. And then we also work with kids at a tertiary level where they already have something. Maybe they've had an injury. Maybe they've been in a car accident. Maybe they've been diagnosed with a chronic disease. Maybe they have cancer. Maybe they have chronic complex diseases that we have to manage in the schools. Okay, growth and development. Just going to cover a little bit here of growth and development. I just want to give you the breakout of how we looked at this in the community, and this is how it's going to be looked through in your PEDS class as well. We have a prenatal period, an infancy period, early childhood, middle to late childhood, and adolescence. Development at all these age groups obviously includes physical, cognitive, and psychosocial aspects. As far as what you need to know with regards to growth and development, I'm going to take you back to this. What kinds of things would we think about? What would be some primary interventions or secondary or tertiary preventions for all these age groups? Okay, you're going to learn all about this in PEDS. But as community nurses, there are certain things that we need to consider with each of these age groups with regards to primary and secondary and tertiary. Does that make sense? That's really all I want you to know about this. Then we get into common childhood ailments. This is what your, like I said, discussion question is on. You'll learn you'll learn about this in PEDS as well. Your readings this week had little snippets from chapters in your Introduction to Maternity and PEDS book. Okay, so what are the main things we want to know about asthma? What are the main things? Let me ask you, what are the main things?
How to look
I know about asthma.
how to look for the triggers.
What type of activities they can do?
Yep. What else?
Um,
What happens if
asthma
asthma
is
Go ahead.
airway constrictor. Asthma
happens-
is an airway constrictor.
Yep. What happens if
So
asthma is poorly
you wanna
treated?
Oh, they can develop lung diseases later on as an adult.
Absolutely. What are some triggers to asthma?
Foods,
Running.
environment, activities.
Pollen, dust, yeah,
Maybe foods?
foods, allergy.
The one thing, you can't restrict all activity for asthmatics, right? You want them, the goal is you want them to participate, right? You don't want to eliminate all activity. And why is that?
Because they still got to stay active, like as a child, you know, you
Exactly.
still got to stay active, prevent like heart disease and stuff.
You have to exercise their lungs.
Yep. So you don't want to you don't want to eliminate exercise for these asthmatics. You hopefully have their asthma under daily control so that they are able to participate in activities. Right? They maybe only need their inhaler prior to activities. In the school setting, it was kids who would come down to the clinic and take their inhaler prior to going to gym. What about eczema? What's eczema?
Inflammation of
Atopic dermatitis.
Yep. It's an inflammatory condition of the skin. And eczema is commonly associated with allergy and asthma. What about diabetes? We have type 1 and type 2. What's type 1?
What they were born with, like the children. What?
No,
The
they don't have to be
juvenile
born with it, but what one is
Type
Type
insulin
1,
dependent?
One
What
is
type
is
1
insulin
doesn't make
dependent,
insulin.
one of them is not.
Right. Which one is insulin dependent?
Type 1.
Type 1,
Okay. All right. And what about type 2?
it is
what develop.
controlled by diet, food.
Diet and exercise, right?
Yes.
And the reason why common childhood ailments is brought up in week 2 is it goes along with the school nurse,
Mm-hmm.
right? Conjunctivitis. What do we want to know about conjunctivitis?
It's inflammation in the
Inflammation
in the lining of the eyelid,
Hmm.
and it's caused by bacteria, viruses, and allergens.
Yep. Yep. What do we want to teach kids? What do we want to teach kids about with conjunctivitis?
Hand washing.
Easily spread.
Avoid touching, avoid rubbing, right?
Mhm.
And in the schools, you have to be treated. You got to send those kids home to go get some kind of treatment. They can come back, but it's going to require some kind of eye drop or some kind of a treatment, some kind of a visit to a healthcare provider, right?
Antibiotic.
Scabies. What about scabies?
Caused by parasites,
Hmm.
lay eggs under the
The
skin.
big burrows in the skin.
Yeah.
Mm.
How is it treated?
With topical.
I'm just referring back to your readings that you did this week. How is it treated?
With topical antipyretic parasitic creams like
Mhm.
Elamites.
Mhm.
Sometimes you can do it with oral interventions.
And what do we teach the families that have the kids with scabies? What do they have to do at home?
That they have to wash
Wash and dry
wash
everything.
water.
Yeah.
And-
Yeah. Okay, lice. What about lice?
I have a
Jesus.
question. What do they have to do with scabies?
Pardon me?
The kids with scabies, what do the parents have to do?
Clothing, bedding, stuffed animals should be washed and dried in high heat.
High heat.
Okay.
Okay. What about lice?
Hmm.
What do we know
It's
about
shared
lice?
through combs and brushes. Shared through combs and brushes.
Right?
And sleepovers.
Mhm. Does lice have anything to
You
do
know, you
with
want-
kids having dirty hair?
No.
No,
No. That is a myth. It's very easily transmitted. Like you said, combs, hats, hairbrushes, person-to-person contact. But lice don't jump from backpacks to backpacks. You know that, right? But people do think that, right?
yeah.
They
Yeah.
don't jump from backpack to backpack. They just don't. All right. Initially treated with a lice product and then retreated in a week,
Mm-hmm.
right? And one of the things we have to work with the families is combing and brushing and trying to get all those nits out, right? ADHD. What's ADHD?
Attention deficit.
Mm-hmm. And what are we going to see with kids with ADHD?
Hyperactivity.
Hyperactivity, lack of focus.
Oh, attention span.
What
Impulsive.
else?
Impulsive. Yeah.
Low self-esteem.
Distracted.
And a lot of times you're going to, let's say a kid hasn't been diagnosed yet. Maybe you're going to see underperforming in the school, in the classroom. Maybe behavioral issues, right? Maybe aggression. Can be treated with medication,
Yes.
right?
Yes.
Can or cannot. I mean, it's up to the parent and the physician to decide that. What are some things that you might want to suggest to the teacher? Let's say you're in the schools. What are you going to suggest to the teacher of how to help this child be successful in the classroom?
Place the child in the front.
Yeah, in the front. Yep.
Giving
I
clear
have a
and short
question.
directions.
Tutor,
Miss
tutor.
Marvel,
Yes.
for kids with ADHD, there's no specific testing for that, right?
Yes, it is.
No, there is. I think it's the Connor scale. If I
Okay.
remember correctly, there is the Connor scale are their behavioral surveys given out to the teacher, the parent, and whoever else is involved with the student. And that's how they're rated, and that's how they make the diagnosis. Then it's up to the parent and the doctor to decide whether they want to put the student on medication or not. We were talking about what we can do in the schools, right? These kids,
Mhm.
think about it. They have lack of focus, lack of attention. Maybe if they do start on medication, maybe it becomes under control. But we also want to give them they have a short attention span, right? So we want to give them clear, short directions. We might want to put them at the front of the class, not as a punitive punishment, but because maybe they'll pay attention better if they're in the front of the class. Giving them frequent rest breaks, right? We don't want to limit let's say they're acting up in the classroom. We don't want to limit their recess time, right? That's punitive to them. They need that kind of outlet. They need that kind of exercise. Tutoring. Some students may need tutoring. Some students may need a behavioral contract, but not all. Right? Maybe they need to work with the school psychologist or the school social worker. Iron deficiency anemia. We talked about the foods. We talked about egg, liver, red meat, eggs, dark green leafy vegetables, dried fruits. This was in your reading, right? Vitamin C can be helpful. Iron deficiency, long-term iron deficiency anemia without being treated can affect growth and development, can affect cognitive development. Scoliosis, what's the difference between scoliosis and functional scoliosis? What is scoliosis?
Posture. The posture is the difference.
It's the curvature
Posture,
of the spine.
yes. Functional scoliosis has to do with the posture, where regular scoliosis is the curvature in the spine, the S-shaped curvature in the spine. Right? Maybe you'll see one shoulder that's higher than the other. Maybe the arm to body spaces is unequal. Maybe one arm appears to be longer than the other. And typically we do scoliosis screenings in the schools. Just like we do vision and hearing screenings in the schools. We'll do a scoliosis screening. And that scoliosis screening should be done prior to middle school. So we do that in the elementary school. Yes, Charmaine?
Is functional scoliosis, posture, having to do with the posture is the only difference in
That's the only difference. It's
okay.
posture related.
Okay, thank you.
Yep.
Mhm.
Okay, so screening should be done before middle school, right? You observe the back, the shoulders, the arms, and the hips while the child stands in front of you and bends over. So you're looking straight on at the spine, looking for any abnormalities. You can't do it with a child standing up. They have to be bent over. Then the last common childhood ailment is lead exposure. Before I forget, in your discussion question 2, make sure you read all the directions. You have to identify 3 of them, but you have to come up with a 6-point teaching plan for the parents for each one. Not for just one. Don't just do one 6-point and have it include all 3. You pick one, you talk about what it is, and you develop a 6-point teaching plan for parents. Because remember, we're the school nurse, and we're part of a community health team, and most of what the school nurse does, a huge part of her job is teaching. Right, so if I have a newly diagnosed kid with scoliosis and I'm going to be talking to the parent on what our findings were, they'll have to confirm it with the doctor, of course. But it's up to me to go through a teaching plan. What do we look for? Do we need to change the diet? Do we need to change activity? You know, if you pick ADHD as your childhood ailment, right? What do we want the parents to know? It's not the end of the world. You and your doctor will talk about whether medication is appropriate or not. Let's bring the teacher in and talk about strategies in the classroom that might benefit your child. Right. So when you're looking at this discussion question, make sure you do a 6-point teaching plan. You're thinking about, what are you going to do with the parents? That's your job as a school nurse. Okay, let's talk about the last one, lead exposure. What's significant? What's the criteria for places or areas that maybe have a higher risk of lead exposure? What's the cutoff?
The,
From your
Those
readings.
buildings,
age of, okay, go ahead.
Since when?
1978.
1978.
1978 is your cutoff. So if you have a daycare, a school, a work area, a rec center, or a place where kids congregate inside that's before 1978, a lot of this has been corrected, right? Especially going forward. But before 1978, it is known that there was a high risk of lead exposure. So lead is present in the paint applied prior to 1978. As paint chips away, chips are inhaled or orally consumed by whoever's exposed. Also, lead plumbing materials were used before 1978. So you live in an old house, has original plumbing. We know that lead levels in Americans has been declining for years. We actually used to test lead levels in all children. We don't do that anymore. Okay, as we talked about, lead can be associated with developmental delays, cognitive delays. That was one of your quiz questions, right? Lead exposure may be inattentiveness, distractibility, hyperactivity, disorganization. So think about, what does that sound like?
ADHD.
ADHD. So you have to dig deeper. Higher levels of lead are also associated with headaches, abdominal pain, constipation, clumsiness, agitation. So as the school nurse, this is part of your nursing process. This is part of your assessment of interviewing families,
Hey,
right? And obviously the treatment is removing the exposure. I mean, think about it. Think about little kids. We talk about lead exposure. They live in an older house or older daycare. Let's say the paint's chipping off the windowsills, off the walls. What do kids do? What do the kids do with those paint chips?
put them in their mouth.
Put them in their mouths. Right. Okay, last part I want to cover is adulthood and the family, which is the section on family nursing, family health risks. Okay, there's three areas of adulthood. Young adulthood is considered 18 to 35. Middle adulthood considered 35 to 65. Then older starts at age 65 and lasts all the way till death. What kinds of factors contribute to adult health? Diet, exercise, stress management, all those have a major impact on health. Heredity also has a major impact on health. Are you genetically predisposed to certain conditions? So maybe alcoholism, heart disease, cancer. When we talk about family nursing, okay, what's the definition of a family anymore? Is there a definition of a family anymore? What's the proper definition of a family? You want the
Whatever they
answer?
said it is.
Whatever, exactly. The proper definition of it, there's no common definition of a family anymore. It's whatever the family says it is. Right? Whomever, how, I mean, think of all the different makeup of families are. Okay, but what there is that's standard is from a community perspective, okay, there are functions. There are functions of every family. Okay, and these are the bullets of the functions. This looks different. We evaluate families on all these different functions. So slide 9 is a good slide to know. Okay, we know that family is defined as a group of individuals who care about and care for each other. Right? So here's your makeup of the family. Here's the common, how many are there? 2, 4, 6, 8. There's 8 common functions of a family. This looks different in every single family, but these are the common functions. Physical, right? Providing the essentials for life. Physical function. Protection, right? Does the family provide an atmosphere that's healthy and safe? The function of nurture. Does the family provide loving care and guidance? The function of socialization. How does everybody interact with each other? Do they get along? Is there a lot of screaming and yelling? Is there a lot of fighting? How is the interaction? What if you have grandparents living with you? What if you have relatives living with you? How is the interaction of everybody? When you go into the home and do these family assessments, these are the things you're going to be looking, these are the kind of functions you're going to be looking at. The function of education. Or does the family teach each other about values, morals? Reproduction. Are there a lot of kids? Are there too little kids? Are there too many kids? Can the family handle all the kids they have? I don't know. That's what you're assessing. Recreation. It's always believed that families who do things together, spend time together, bond together, have a higher function. And then the function of support. How does everybody help and care for each other? So if all these are positive in a family, when you do your family assessment, you consider that family a high functioning family. But if there are issues with 1 or 2 or all of these, that's considered a very low functioning family. And if you're working with this family, like I did with many of these families in the schools, it takes a lot of work. It takes a lot of work to get them the resources they need. Whether it's actually food, emotional services for the kids, working with the social worker, the psychologist. But all these make up the functions of a family. And depending on how each of these is working, positively or negatively, is going to coincide with all the work that you're going to need to do to help this family. So I know I was a school nurse working with the kids in the schools, but much more often than not, I was working with the whole family. Does that make sense? Okay. I talked about that. Failure to meet these functions leads to dysfunction, strife, crises. I'm just reviewing my notes to make sure I cover everything. A strong contributing factor to future substance abuse, anxiety, depression, work absenteeism, unsafe sexual practices is a dysfunctional family. I'm back on this. Right? We know the family is our first and most important safety net and social support system, right?
Mm-hmm.
Okay, family health risks. I think we're on our last slide here. Disease develops based on these three kinds of risks: genetic, environmental, behavioral. All right, when we're caring for families, we have to consider all three. What does genetic mean? It means we're born with certain predispositions, right?
Yes.
We're born with certain predispositions, but the majority of diseases are not genetic. Okay, but genetics can play a part in it. That's where you do family histories. Maybe you're doing your genograms, which is going back and asking clients to do 3 generations of what was going on in your family in the last 3 generations. Who died at what age, with what. And that way you can identify cancer risks, alcoholism risks, substance abuse risks, cancer risks. What else? What else could we be predisposed to? Developmental delay risks. What else?
Diabetes.
Diabetes, heart disease, epilepsy, right? Second is environmental. This is all the things going on are in our environment. We've talked about some of these. All right. Let's say you live in a high crime neighborhood. Let's say you live in a neighborhood that's full of pollution.
Oh my God.
Right? Poor living conditions, high stress environments. Maybe there's discrimination that goes on in your community based on race or social status, religious biases. Immigration status is a big one. Ethnicity. Maybe you have lack of financial, these are all environmental risks that affect the family, affect family functioning. Lack of adequate financial resources. Maybe you live in poverty. Lack of social resources in the community. Right? All these lack of is going to lead to higher risk. And then the last is behavioral. Those are the choices we make. Okay, let's say we don't eat healthy and we're obese, or we don't eat healthy and we develop diabetes. Let's say we eat hot, let's say we don't exercise, we don't eat right. All these can potentially contribute to chronic diseases down the road.
Mm-hmm.
Heart disease, osteoporosis. Okay, so families play a really important role in modeling healthy eating habits, healthy behavior, healthy coping mechanisms. Right? That's why if you go back to here and look at how some of these function or don't function, that's going to be a direct result of risk. Dysfunctional families lead to risk. Lots of risk factors. Right? Kids who grow up seeing violence, bad language, substance abuse, drug abuse, yelling and screaming. Just think about it. Think about the environment, right? You guys all know what a healthy environment is and a not so healthy environment.
Right.
This affects our jobs as community nurses. The other thing that's behavioral as well is risks of falling, risks of fires, risks of drowning, suffocations, poisonings. These are all about our choices. Think about exposure to secondhand smoke. Think about if you have a smoking household, right? Now, let's say parents or whomever lives in the house smokes in the house or smokes in the car. Those are behavioral risks. Right? So we don't typically think about all these things when we're caring for our clients in the hospital, right? I mean, we're caring for somebody, a family member in the hospital, but we don't think about all these additional, hey, I wonder what's going on at home. You know, we just don't think about it. I thought a lot about it as a school nurse because you really had to use your assessment skills to figure out what was going on. And it was amazing the things that were uncovered or discovered from doing the full, you know, you start with the kid assessment in the school setting, but then you move out to the family and do the family assessment. And you start connecting the dots. This is what you do out there in the community as community nurses. So I know we covered a lot of information, 2 weeks worth. Helpful? You have a little bit better of a perspective of just how far we have to reach out. I mean, think about it. I told you guys in our introduction last week, in the community, your client, your patient could be an individual. For me, it was a kid in school nursing. It could be a family. You're working with a whole family that may have babies to middle schoolers, to adult children, to grandparents living in the house. You're working with a whole family unit. You could be assigned to be working in a long-term care facility and all your clients are elderly. So you have to understand how to care for the elderly, not just med-surg wise, but all those other issues that go on with the vulnerability of elderly populations. You don't typically think about that in the hospital setting. But if you're in the home setting or long-term care setting, you have to look at a whole different set of standards. So our clients can be an individual, a family, a subset of the population like the elderly, or if you are working at the health department, maybe you're looking at the whole community. What is this? I always use a scenario. Let's say you decided you were going to take a new job in the next state over from where you live in this community. You don't know anybody there. You've never even been to that state, but you're now their community health nurse or public health nurse. Those two are used interchangeably. So you pack up all your stuff, you drive to this new community, you know nothing about, don't know anybody there, and your Department of Public Health person says, hey, do me a favor, before you get started, you're gonna need to do a community assessment. What does that look like? And how do you accomplish that? You got to figure out, have you heard of the windshield survey? Windshield survey, you go out and drive around. You go out and walk around. Go take the bus. Go ride your bike. Go take the dog for a walk. But you're out in the community walking around doing all your observations. Wow, this is a pretty big community. Wow, I see a lot of elderly people. There's a lot of long-term care facilities. Or there's a lot of schools. It must be a younger community. It's dirty. There's a lot of garbage on the ground everywhere. It's really clean. They have a lot of parks, a lot of places for people to do things and families to go to have picnics, or they don't. The roads are terrible. The community looks run down, or it's a beautiful new community. Those are all the things you're thinking about, right? And then you start to go find your key team members. You know, maybe you talk to the police, the law enforcement. What's your community like? Oh, we have a pretty high crime rate. Oh, we have a pretty high gang rate. Nope, it's good. It's good. Schools, you talk to the school people. What are the schools like? No, we have a lot of failing. You know, our kids graduating high school, only 10% can read at the whatever level, whatever. Or, hey, we have a great graduation rate. We have 94% graduation, whatever. You got to look at what's your healthcare? Is there a hospital in the community? Is there a clinic? Is there nothing? Are there medical office buildings? I mean, all these things factor into your final assessment of what is the health of this community. What are the strengths? What are the weaknesses? What are the areas of improvement? Because remember, you're the community nurse. Once you do your assessment of what kind of community this is and what the needs are, then you start your work. I got to get working with the school nurses to talk about this. Got to get working with the occupational health nurses who work in the work settings in this community, because it looks like 60% of our hospital admissions or urgent care visits are from workers' comp, people who got injured on jobs. Or hospice nurses. You know, we're unable to get hospice patients out of the hospital into the homes. Why not? Or why? Let's look at that. So does that make sense? So your community you live in now may be a very high functioning community. It also may not be. But assume you're their community nurse. What are you going to do? Who are you going to talk to? How are you going to figure out what's going on? How are you going to figure out what your goals are? Short term and long term. How are you going to figure out what kind of programs, what kind of education needs your community needs? Is there a lot of at-risk community members, vulnerable populations? There are a lot of tertiary clients that already have things going on. You know, we'll talk about rural populations and migrant farm workers. Rural populations are full of people with chronic diseases, full of people that live in poverty. How do you work with them? So it's a lot to think about in every community, right? I mean, there really is. Every community looks different. So that's my week 1 and 2 coverage. And then we'll start to branch out on specific issues within communities. That's in the upcoming weeks with vulnerable populations, specific vulnerable populations. In fact, I think we start that next week. Vulnerable populations, I think that's weeks 3 and 4. So questions, does anybody have any questions? How'd I do on time? 4 minutes late, sorry. You guys are my long class. We're supposed to go to 50 after the hour, but no break, should be 40. So I'm already 4 minutes over, so I apologize. I hope you guys have a good rest of the
So
week. What?
There's no exam next week?
No,
There's
it's
no
not till-
exam next week?
No, it's
Okay.
not till week 4, but next week you do have exam reviews,
Okay.
right? You have a schedule. I was just putting it on my master calendar today. You have a Monday, next Monday morning, Professor Ford's doing one. Next Friday evening, I'm doing one. And then the following Sunday, before your exam, Professor Kershaw does hers. And I promise you, you'll have all 3 recordings. And I actually stay up Sunday night and wait to get Professor Kershaw's recording so I can make sure my Monday class has that. Okay?
We have a quiz next week though, in week 3, correct?
And
Okay.
it's on week 3 material. We've covered 1 and 2.
Okay, yeah, that's what I was about to ask because today was kind of off guard. So
It's on
yeah.
week 3, just week 3 material. Okay? So with that, I hope you guys have a good rest of the week. Please reach out if you need anything. You know where to find me. I'm hopefully going to do groups in the next couple of days. So you get your groups to, if you want to work on your week 7 project. Don't forget to pull off that HESI prep assignment. I told you that last week. Pull it off your week 1, put it on your desktop. Little by little, you'll be able to complete it. Don't wait till the end. Well, I hope it's been helpful. Hopefully it's interesting information. It's a different way to look at things. We talked about that last week. You got to shift your mindset from acute care to being out in the community. All right, so have a good week. We'll see you guys next week.